Some people are not even going to health centers because of stigma, especially women. We are having complaints about some people saying that I am not going to this health center so and so because of somebody is there, and if he sees me, he is going to talk about me.
For Betty Jata, AIDS, despite being a deadly pandemic, is preventable, and as such, Gambians, especially those who are sexually active, should go in for voluntary counseling and testing. Having thanked UNDP and their partners, she appealed for more sensitizations on stigma and discrimination, since it is proven to be preventing many individuals from checking on their HIV status, thereby spreading the virus. Given that development in whatsoever forum should pay considerable interest to people's health, this UNDP Development Forum, focusing on HIV/AIDS-related stigma and discrimination, may serve a significant step in the fight against the pandemic. Modu Bajan, Grts.
The Food and Agriculture Organization recently held a two-day interface for stakeholders in the FASTDEP project. The forum that dealt with the technical component of the intervention is designed to improve the agriculture and natural resources sector contribution to the growth of the economy. We have more in this report by Rahibite.
As the technical assistance component of the Global Agricultural and Food Security Program was organized by the Food and Agricultural Organization of the UN. The technical assistance component, worth $1.4 million, seeks to cover critical technical assistance and capacity development support identified in the Global Agricultural and Food Security Program proposal. This is also in full synergy with the project investment component managed by the African Development Bank. The two-day inception workshop is aimed at increasing the contribution of agriculture and natural resources sector to economic growth through commercialization.
African countries are striving to invest more of their own resources in agriculture. We have also learned that the recent budget speech that was delivered, and Gambia is also increasing its investment in agriculture up to, I think it was 7.7%. So this is good news, and we're hoping that the trend will continue to meet the target of 10% according to the Mobutu Declaration.
The level of agricultural development in most countries is referred to as inadequate. This also looks at the work of the Ministry of Agriculture in its quest to feed the whole country.
We have our shortcomings. In particular, when we talk about capacity building in the Ministry of Agriculture, we look at our data collection aspect of the ministry. We look at other areas where we have a shortfall in terms of technical aspect of the Ministry of Agriculture, in terms of engineering, in terms of water management, in terms of planning. These are areas where the ministry is really emphasizing, and the ministry is very concerned that we need to develop these areas in order for us to achieve our national goal of self-food sufficiency.
FASTDEP and GAPS are two key areas selected by the Food and Agricultural Organization to reduce household poverty, food security, and malnutrition for overall economic growth and national development. Project development does not only lie in the hands of coordinators alone, but other stakeholders working towards the implementation of the projects. This, as the Regional Agricultural Director stated, his department is working tirelessly towards the implementation of agricultural projects for national development.
Stakeholders are invited here because there is the feeling and there is the belief that it is very important that they are part and parcel of the activities of the technical assistance component from the very beginning, so that they can contribute in terms of the development of the work plan and budget, so that they can also contribute.
This two-day synergy is expected to provide an opportunity for all stakeholders to familiarize themselves with projects and provide input into the relevant outcome areas, thereby facilitate alignment with the main food and agricultural sector development project. This can only be achieved through strengthening knowledge, skills, and practices that improve production, commercialization, and market access. Rahibite, GRTS News.
Well, forces loyal to former South Sudanese vice president captured 2 major towns. And days after his serious skiing accident, Formula One legend Michael Schumacher remains in a medically induced coma. We will look at these stories when we return.
Jales Akuntu, Nuva, Budi Nanani Chibir Penchami, Ha, Titi, Dinamane, Budi Dinamane Hangini, 1st of January, New Year's Day, Life to Penchami, Yaksil Titi.
Assalamu alaikum. 31 décembre, le 1er janvier, fan lay doon ñu ne penc mi Paradise.
Galadino, Platinum, $40,000. Gold table, $30,000. Individual tickets, $1,500. 1st of January, dance, tickets, $400. VIP, $600. Lee, Nehna Bepare, special guest, out of Europe, Gambia's modeling queen, Regina Mane in the building. We see all a happy new year in advance.
Welcome back, and now to news outside the Gambia. South Sudan media say that President Salva Kiir has declared a state of emergency in 2 states with 2 major towns under rebel control. The report also says President Kiir has sent a negotiating team to Addis Ababa for peace talks. CNN senior international correspondent Awa Damon is in the South Sudanese capital of Juba and tells us more about the situation on the ground in relation to the 2 states that are under a state of emergency.
States, Unity and Jonglei, where much of the violence has been concentrated. Unity is also home to a lot of South Sudan's oil fields. Jonglei itself, the town of Bor there, has been going back and forth between government and rebel control. It is currently in rebel control, and there have been some clashes, although the violence has not been as severe. The fighting has not been as severe, according to the UN today, as it has been in the past. We heard earlier in the day from the UN Special Representative here, Hilda Johnson, who was saying, though, that even if these talks do lead to a ceasefire, the violence in this country may not necessarily end.
There has been killings and brutality, grave human rights violations and atrocities committed. We have seen evidence of apparent ethnic or targeting of South Sudanese citizens on ethnic grounds. This can lead to a perpetual cycle of violence that can destroy the fabric of the new nation.
It is really going to be up to the forces, the key players at this stage, President Salva Kiir and Riek Machar, to try to come together, end the violence, and make sure that that cycle of violence, that ethnic killing, does not continue in this country. And of grave concern, Fanula, at this stage is not just the impact that the violence is happening, but also that the violence is having, but also growing concerns about the health of many of this war's youngest victims.
And given the backdrop of this violence, how much of the country is affected? How many people have been displaced from their homes, and what kind of conditions do they face in the UN or other humanitarian camps they go to?
It's a very dire situation, Fanula. There are around 180,000 internally displaced people, and that's only the figures that the UN is itself aware of, and less than half of them are at UN compounds. And even those who are at UN compounds are facing a number of risks.
3-month-old Ron has diarrhea, a fever, and cough. His mother, Elizabeth, is just 15 years old, married at 13 after her mother passed away. He wasn't sick like this at home, she tells us. I'm worried he will not be all right.
My baby is very brave.
Her concern is justified. Most of the cases arriving at this mobile clinic, set up by Doctors Without Borders at a UN compound in Juba, are severe diarrhea.
Diarrhea can kill a child really fast if the dehydration is very severe.